is wrong?
Yeah, this is a very common problem which we encounter in our daily practice. So let me just show you the right way to use an inhaler. So this is a new type of inhaler called as a Synchro Breathe. So it doesn't need a hand-mouth coordination to use it. So this is the inhaler. It comes with the 120 meter doses. You can see it in the, it's written here in green. And first have to shake it for 5 seconds at least, and then open the lid, and then if you are using it for the first time, release the nozzle first so that the test dose is gone, and then now your inhaler is activated. Now shake it, open the lid, first take a complete breath out, then put the inhaler inside, and once you put the inhaler inside, take a deep breath to your full maximum capacity and hold it for 10 seconds like this. Release the breath. So that is how you use the inhaler, and once you finish using it, rinse your mouth with water. This will prevent any fungal infection over time. It can happen with inhalers without, if you don't wash your mouth with water. So this is the right way of using an inhaler. This is about a Synchro Breathe inhaler, which is the latest technology. But if you use the other inhalers which are commonly available in the market, uh, instead of directly putting it, you have to just press it down here, and the puff will be released. That is the only difference.
So your sleeping position could be affecting your breath.
Yes, definitely. If suppose a patient has all the risk factors like obesity, if he is a hypothyroid or hypothyroidism, and he has issues with snoring, if he is sleeping in the supine position, like lying down with the face faced upwards, that could be worse actually, because what happens is this could increase the pressure on your airway. So your soft tissue of your neck and the cheeks and your body fat can put pressure on your airway and cause increased snoring and increased breathing difficulty. So for patients who have sleep apnea, we encourage them to sleep on the side, so, to offset this pressure.
Does it affect to comparing with the left side versus right side sleep?
No, it's not like that. It's not about the side. Any side to which patient is comfortable, it's fine. So we have some devices also, which wearable devices which we give our patients, which has a ball attached to the back, so that prevents them from sleeping in the supine position.
So common mistake that asthma patients are doing it daily.
So one common mistake which I would like to highlight is they stop using the inhalers when they feel symptom free. So the whole definition of asthma is it's an episodic disease. It comes and there are interval days where the symptoms are not there. That doesn't mean you have to stop using your inhaler. So asthma, the inhalers are prescribed for a sustained, dilatation of the airways. So that is one common mistake which asthmatics do.
So your posture is affecting your breath more than you think.
Yeah, it can affect your breath. Suppose if a patient is, if a person is slouching like this, that reduces the lung capacity to expand. That can affect your, breathing pattern.